Well, folks, a new drug shows advancement in the fight against Alzheimer's, but are there side effects and are they worth it? Here to break it all down, neurologist Dr. Teryn Clarke. Doctor, whenever you mention Alzheimer's, anybody who has been touched by it as we were in our family, obviously you have an interest in any advance. So what can you tell us about this new drug?
Thank you for having me. I mean, we have been desperate for a new effective medication to treat Alzheimer's disease. And this one shows some promise. So I think that the medical community is encouraged right now. This medication did show clinical benefit in patients. It was mild, but it was shown to slow down the progression of Alzheimer's disease by several months. And if we can keep our patients in the earlier stages of Alzheimer's disease that are more mild for even a couple extra months, that may be beneficial to patients and their loved ones. So in terms of the effectiveness, we're encouraged. As you mentioned, there were a lot of side effects noticed in the trial as well. And so that's a concern that we'll have to follow going forward.
If you're going to say a drug does good things, but then there are potential negative side effects, how do you weigh if the benefits are better than the potential side effects? How do you make that call?
So that's a great question. And in this class of medications in particular, this comes from a class of medications where we're using antibodies to target amyloid, which is one of the proteins we see in the brains of people with Alzheimer's disease. And as a class of medications, every drug company has had a medication in this class that's gone through trial in the last decade. And universally, as a side effect of these medications, we've seen brain swelling, we've seen small hemorrhages. And so in this particular trial, 7% of the trial participants in the treatment group had to stop participating in the clinical trial due to side effects. So that's a side effect we'll need to watch for. We know these medications are getting into the brain where they're having an effect, but there are also some side effects that can be harmful. That becomes important because in clinical trials, generally the patients who are able to participate are less sick than the general population. So as we roll this out to a larger population of patients, they're likely to have more other diseases, and we may see that side effect rate even increase a bit. So they'll need to continue to monitor.
Is it too soon to tell how much this would cost and whether Medicare would be covering this kind of treatment?
I haven't seen any cost analysis on this. The question comes up because there was another medication that was recently approved, and the cost of that medication, Aduhelm, was initially $56,000 a year. And that had to be dialed back in price by the drug manufacturer, and there have been pretty significant limitations on insurance coverage. Having said that, Aduhelm was controversial because it didn't show clear clinical benefit. The most benefit it showed was on imaging studies, like improving people's PET scans. And this medication that we're talking about now, lecanemab, does seem to have clinical benefit to patients that was measurable in the trial. So that may make a difference in terms of insurance coverage, but it would still only be for patients who are very early in this disease process.
Well, we hope any gain, is a positive one.
Right.
And we know it's like sometimes 2 steps forward, 1 step back, but hopefully we're getting somewhere. Dr. Teryn Clarke, thank you so much.
Thank you.